Tuesday, December 21st, 2021. This is Kathy Turner, Director of Communications for the Department of Public Health and Wellness. Mayor Fischer is our host today, and joining Mayor Fischer today are Dr. Sarah Beth Hartlich, Associate Medical Director for the Department of Public Health and Wellness, Dr. Sarah Moyer, Director of the Department of Public Health and Wellness, and Dr. Valerie Briones-Pryor with U of L Health. I'd like to remind everyone to please mute your devices, place your questions in the chat addressed to everyone. Mayor Fischer, I'll now turn things over to you.
All right, thank you, Kathy. And first, happy holidays. Merry Christmas to everybody. But the Grinch is still amongst us, if we want to call the dastardly virus the Grinch, because virus doesn't want to go away, and it's not planned to go away. So we got a lot of news and developments to talk about here this morning. First, a little reflection back. It's just over a little bit over a year ago, December 13th, 2020. Was a pivotal event here in our city in our efforts to overcome COVID-19 and help to reopen our economy and society. It was when we had the vaccines available. And we have obviously a lot of proof now, more than a year's worth of proof that vaccines are safe as practically anything that you'd find in your medicine cabinet at home, and they've been highly effective at preventing serious illness. The sad fact is that we have lost almost 1,800 people here in Louisville, and it's especially sad as we reflect around the holiday season and think about people that would be with us at the table, but it's an empty chair right now. I'm grateful and that the toll could have been a lot higher, but I'm also frustrated that it could be a lot lower if people would get vaccinated and watch after themselves and those people they love as well. So I want to keep encouraging everybody to do that. Now, because of the vaccines, we've seen people return to workplaces and schools and restaurants and theaters, family gatherings like the ones that we had over Thanksgiving. No doubt we'll have over Christmas as well, with confidence amongst family groups and friends groups that communicate on where they're at with the virus and where we're at with the vaccine. And it's important to know, especially now, how to do that, because the new Omicron variant is presenting greater challenges in terms of its infectiousness. And we're seeing this all over the world. It's been a little slow to get to Louisville, but it's with us right now, and its replicability is very, very fast. So soon, within the next couple of weeks, it will be the dominant strain here in our city. We've got confirmed cases of the Omicron variant here in Louisville. It's been here, no doubt, for a while. When we pick it up, we picked it up in wastewater samples over a week ago right now. So it's just a matter of time before it becomes the dominant strain, as I mentioned here as well. All you have to do is look around the world. We're not exceptional in terms of how we respond to the virus or how it impacts us as human beings. You can take a look at the United Kingdom right now, which has usually been a month or so ahead of us in dealing with pandemic threats, and cases have increased there 71% from the average just 2 weeks ago. Astonishingly, there and some other places are setting new peaks for cases for the entire pandemic, which is hard to get your head wrapped around, but that's what we're seeing. Its deadliness is still open to study, but there is no question that it's infecting people at a very, very rapid rate. And we're seeing similar situations play out here in the United States. You can look at what's happening in New York City right now and some of the other cities and states up in the Northeast. So we have not seen this Omicron spike yet, but as I said, it's coming here just as you take a look at other places. So we still have time to act somewhat. We're not going to avoid it altogether. But the good news is that preparation for Omicron appear to be the same as protecting ourselves from Delta and the other forms of COVID-19. And if I asked everybody to predict what I would say right now, you would be saying, yes, it is vaccines and it is boosters. So the science indicating that Pfizer and Moderna boosters provide strong protection against infection and serious illness against the Omicron. So the more we learn about Omicron, the more we expect boosters to be absolutely critical to getting through a future wave without jam-packed hospitals and medical centers like we saw here in Louisville about a year or so ago. So if there's any takeaway from this today, it is If you are eligible to get boosted, get boosted. That is your primary weapon to keep Omicron from attacking you. That's what all the science looks like at this point in time. If you're not eligible to get boosted right now, still go ahead and start your vaccination protocol. Okay, let's stay with these basic precautions that everybody can take. You can see here on the screen who can get a booster shot and what all is involved with that. So we're going to get more into the medicine of this today, and our medical professionals will brief us and offer guidance on all the steps that we can take, starting with vaccines and boosters, shots. The first two protocols, the boosters, the third, are available all over the city. So there is no logical reason to delay. So let's jump into the data and hear from some medical experts here. First, going to bring in Dr. Sarah Beth Hartledge. She's our Associate Medical Director, ran LUVAX out at Broadband and LUVAX Mobile. Doc, here we are again. As we were talking before this, we didn't really want to be at this point, but we are. So how do we move forward, and what's it look like today?
Yeah, so today is December 21st, and exactly 1 year ago today, we had our first meeting of the LUVAX team. It was on the December 21st of 2020. So a little bit of reflection and seeing both how far we've come and unfortunately how much further we have to go. We do have confirmation of an Omicron case in Jefferson County. The patient, at this time, we only have one that's confirmed. And this patient was vaccinated back almost a year ago received first dose in January, second dose in February, and tested positive in early December. Her sample wound up getting tested for sequencing. She has had a monoclonal infusion antibody. She has done very well, but we do have a confirmed Omicron case here locally. I think those of us who follow these things are well aware that it's probably been here for a couple of weeks. We just haven't managed to capture it in a lab setting. So looking at that's an individual, but if we look at the data on a wider level, we are in the red. So we have an average daily incidence rate, scroll down for me, of 38.1 cases per 100,000 of population. I will say that 38 number is an average of the daily incidence over the last week, and the incidence rates over the last few days have been much, much higher. 45 or 50. And so I would expect to see that number rise substantially by next week. We had 24 newly reported deaths and over 2,000 newly reported cases. If you take a look at the little bar graph here, you can see we're kind of swinging back up again over the last week or two, as we have probably been seeing some Omicron that hasn't been confirmed, and we do continue to have Delta here on the ground as well. Vaccinations remain the #1 best protection that you can have. We've given 1.6 million doses here in Jefferson County. We have folks who have completed their 2-dose series, 473,880. We have 548,241 folks who have received at least one dose. Those numbers are going up as we've gotten a large number of kiddos in the 5 to 11 age group have gotten vaccinated over the last few weeks, since they just became eligible for vaccination about a month ago. If you take a look at the colored dots here on the side, the bright green one is the boosters, and so we are seeing an increase in booster uptake, folks going out and getting their booster dose. Essentially, everyone over the age of 16 is eligible for a booster at this point. If you have had your Pfizer or Moderna 6 months ago, or if you had Johnson & Johnson or Janssen 2 months ago. So almost everyone is eligible, and it is encouraged to go out and get that booster. Mayor talked a little bit about what we tend to look toward Europe a little bit to see how things go over there, and what we see from them can typically be applied to the United States a few weeks to a month later. And the Israelis were the first to get out in front of the booster train. So they have just published a study that shows an 86% reduction in testing positive for COVID if you receive a third dose or a booster rather than just the 2-dose series. So the last thing I'm going to cover here is that our hospitalization numbers are holding pretty steady right now. They're up from our doldrums back last summer, but it's a gentle upward slope and relatively stable. But remember, we've seen time and time again that the cases peak first, and then we'll see hospitalizations and ICU admissions will peak a couple of weeks afterward. The ventilators, same thing. So we expect to see those numbers go up over the coming weeks as the number of COVID cases goes up. The jury is still a little bit out on Omicron in terms of how severe it may or may not be, but it is very, very contagious, very transmissible. And I just remind everybody that a small percentage of a very large number is still a large number. So even if the percentage of folks who are having severe infections needing to be hospitalized, even if those percentages are low, it can still place a big strain on the healthcare system. And you want to make sure that you're not taking unnecessary non-COVID risks either, because if you fall off your ladder, there may not be a whole lot of space in the emergency department for you. I think that is it. We'll go back to you, Mayor.
A little bit. I mean, but thanks, Dr. Harlage. And so before we jump back into the booster discussion, and I do want to say thank you again. You and your team did an incredible job at LouVax Mobile, and nationally recognized for that. But any reflections on that? And then as you look to the challenges today, anything we can learn from that experience?
Yeah, I have said before, and I'll say again, it's probably the best job I'll ever have. Many times working in healthcare, you deal with frustrated patients or frustrated staff members, and you have to try to recognize that you're meeting that person on perhaps the worst day of their life. Whereas at LouVax, especially in the early days, people were so excited to get their vaccine. They really, really wanted that choice, that chance to protect themselves and their loved ones. And the way that the community came out and pitched in together to get that done is truly amazing. I know I said before that I may have been the face of the operation, but the volunteers are the heart and soul. We had over 2,500 volunteers, and they were truly wonderful to work with. It's really fun to have a motivated group of people who get together and work on something like that. Everyone from retired nurses to we had a UPS pilot that worked for us. We had a couple of bartenders, some stagehands, and so just school crossing guards, lots of folks, people from every corner of the community really coming together to get it done. And I will forever be proud of that option and the way that program rolled out.
Yeah, that was great. Our former police chief, Steve Conrad, was also helping there. I was always glad to see him there. Let's jump back into the boosters. Right. So I'm the armchair doctor, as you guys have figured out. I'm married to a doctor, so I think I can ask these medical related questions, but oftentimes I don't know what I'm talking about. So you all help to clear that up. But I am amazed at how the booster increases your antibodies like 50 to 70 times. Do I have that right? And if so, why does that happen?
So for the most part, I think that what we're seeing is a factor of time. So many people who got their vaccines early on. It really has been like a year. And so they have some immunologic memory, but they don't have the strong B cell response with antibody production, and getting the booster dose helps boost the direct antibody production.
And it's that increased level that's helping fight Omicron.
Yes. So if the antibody, even if the antibody that we make is somewhat imperfect in relation to Omicron, having a lot of it helps make up that difference.
Gotcha. Okay, and then other issues that are around this time of the year, typically the flu's amongst us. So can you give us the status on influenza?
Yeah, so our flu numbers have gone up quite a bit in the last few weeks. I think we have a slide from flu. So all the good news is that all the things we do to help protect against COVID, avoiding crowds, face coverings, and hand hygiene, all those things can also help protect you against the flu. There is, of course, a flu vaccine out there that we recommend that you get. But if you take a look here, you'll see that Jefferson County is the only one in Kentucky that is in the pink. So we have over 400 cases here locally. Obviously, we have more population. So take that a little bit with a grain of salt. But if we look at this next one here, just a few weeks ago, we had barely any flu cases at all. 2 weeks ago, we were at about 50. A week after that, around 200, and now over 400. So we do track those numbers. And again, you certainly don't want to get infected with the flu and COVID at the same time. You don't want to wind up having to be hospitalized for flu because, again, the hospital resources are going to be limited for with COVID surging. If you look at the age here, interestingly, most of the flu cases are in the younger age group, so teens, 20s to 40s, and that may be attributable to lack of flu vaccination. It's not as popular in that age group. Our folks in the elderly age sets do tend to get more flu vaccines. So flu numbers are way up, and that is a concern, especially given the timing with all of the other COVID and other problems that we're dealing with right now.
All right, one last question on that. They're 400 plus right now, but how does that compare to 2019 before COVID?
So they're very low compared to pre-COVID. So when we were taking no precautions, basically back in 2019, we would have had over 1,000 for sure by this point in the flu season. It's higher, substantially higher than last year, where we had almost no flu cases, partially because folks were staying home and everybody was wearing masks and all that. So we're sort of in the gray zone in the middle, but the numbers are trending up, which is the trend is probably the more concerning part.
Gotcha. Okay. All right. Well, let's go into the hospital now. Thank you, Dr. Hartledge. And let's hear from another one of our great leaders in our medical community, and that's Dr. Valerie Briones-Pryor of U of L Health. You all will recognize her. Besides being a well-known physician in the community, she was also one of the first people in the city to get a vaccine. You might have been the first, Doc. I'm not
I was actually the third. Dr. Smith was the first.
That's right. That's right. Well, a great team of physicians. So thank you for being with us today. What we're seeing in other communities, obviously, is a lot of discussion about concerns of hospitals being overrun now with this more contagious variant. So what are we seeing at U of L Health hospitals when it comes to cases, and what kind of advice can you give to us?
Sure. So across the U of L health system, currently, we have about 74 cases of COVID throughout all of our acute care facilities. If you compare that to middle of November, it's doubled. So when we came out of what I consider that fourth surge that happened early fall into November, where our numbers dropped, we're starting to see a considerable rise again. And the concern is, our hospitalizations are starting to go up, but then we also are taking care of non-COVID cases. So our ERs are full, our hospitals are full. Our staff, we're not immune to COVID either. So we have folks as well out with COVID. And so it's a challenge. It's a challenge right now, and it's concern because we're not considered in a surge right now, but we're already seeing a lot of utilization of resources that is a little concerning now that we know Omicron is here, and worried about what will happen over the next few weeks, especially as people gather for the holidays. A year ago, we were very good about maybe postponing our holiday celebrations, wearing masks. We didn't have a vaccine at the time, this time last year. Only a few of us had gotten vaccinated. We hadn't rolled it out to the public yet. So a lot of folks were still very good about all of the precautions. And so and that helped. It helped us get through the holidays last year. Unfortunately, I don't know if folks are going to be as careful. And so we're very cautious about what's going to happen in the next few weeks.
Mm-hmm. There's been a lot of advances over the past year about treatments to keep people out of the hospital once they have some symptoms of COVID. Can you talk a little bit about that?
Sure. So one of the main, aside from getting your vaccine, of course, one of the main treatments we've been using are monoclonal antibodies. So probably the most popular one that folks have heard about is Regeneron. So Regeneron works wonderful if you get it early. It works within that first week that you test positive. There's even in certain populations, we can use it as post-exposure prophylaxis. So if somebody who's high risk has been exposed but not positive to somebody with COVID, we can use that type of treatment to try to curb the severity of COVID. So it's important that folks ask your primary care provider or your healthcare provider if you're a candidate, if you test positive, if you're a candidate for that, because it has been shown to help.
Okay. And what do we know about the monoclonal antibodies in Omicron?
So unfortunately, it looks as if they're not as effective. So Regeneron may not be as effective against Omicron. It's still early in what we know. And at this point, because when you go and see your primary care provider or your healthcare provider, we don't do the typing that the health department does. So I don't know if you have Omicron versus Delta versus any other strain of COVID. So we're going to treat you and try to give you as much, I call it as much support and that we can. So if you come to your clinics or your hospitals and you just test positive for COVID and you're a candidate for monoclonal antibodies, we're going to go ahead and give it to you because we're not going to know at the time if you have Omicron versus Delta. And we do know that Regeneron still works against Delta.
Okay. And any other challenges in the hospital? I mean, we hear a lot about nursing shortages. How are we doing at U of L?
So just like across the country, we're not unique. We're having staffing challenges, just not with nursing, but with every ancillary service. So we may have empty beds up on the floor, but they aren't staffed. So that means that just like Dr. Hartledge, said, if you come in for a non-COVID or a non-influenza related illness or injury, there's a chance that you might be waiting in the ER for a while, or if you need to be admitted, you might be admitted but hanging out in the ER. In fact, right before this press conference, I was seeing 6 patients that are holding in our ER right now that have been admitted to me, but we just don't have a place for them up on the floor.
Okay. Any other comments before we switch over here?
No, I just encourage everybody to get vaccinated. The cases that I've seen all in the hospital, the ones I'm taking care of today, they're all unvaccinated patients and they're not doing well. The ones who have done well are the vaccinated folks. They either have really mild illness and never see me, or they only see me for a couple days. So the goal for this season is to not have to be admitted to the hospital.
Amen to that. Thank you, Doc. All right, before we go to media questions, let's hear from Dr. Sarah Moyer. Dr. Moyer is the Chief Health Strategist for the City of Louisville and the Director of Louisville Metro Public Health and Wellness. And Doc, let me start off with a question to you that, some people are saying, well, look, there's people in the hospitals that have gotten their vaccines. So, it shows that vaccines don't work. So why should I get a vaccine? What do you say to them?
Well, I think Dr. Val answered that perfectly. You may end up getting sick, especially with Omicron. I think most of us are going to expect to be exposed to it and maybe have mild symptoms, but that vaccine really helps you recover quickly. keeps you out of the hospital. It does its job in protecting you. If you look at our data, we do have about 24% of our deaths are fully vaccinated, but they're all over the age of 65, tend to have be much older, have problems with hypertension and coronary artery disease, other things that make them sicker. And so especially if you are young, please, please, please get vaccinated, and older too. I mean, 76% of our deaths in the unvaccinated, and we have very few people now in our city that are unvaccinated. And so it's just huge percentage points. So that risk is much higher.
Well, some of those folks might be getting together for the holidays here coming up. So what would your message be to folks here as they think about family and friend gatherings?
Yeah, so we're in a new wave here with Omicron again, and the rapid rise in cases that we're predicting really has the potential to be more disruptive than previous waves, endangering our healthcare system, our ability to care for people, as well as other businesses, schools, and key infrastructure. As employees get sick, even if they're vaccinated and it's mild, we still are recommending people stay home for 10 days to make sure we're not passing that on to others. So just urging all Louisville residents and workplaces to think about steps now to reduce the risk to themselves, their family, and others in order to help us impact this surge that we know is coming. So if you work in business or healthcare facility, just make sure you're planning for impact on workforce. With Omicron can spread so fast, just having plans in place that like your entire shift being out and what that backup plan is. As Dr. Val mentioned, we're already seeing our hospitals getting close to capacity. And so if we have even more healthcare staff out, just worried about what that means for our community. Schools also are going to see the impact from more cases and staff and students after winter break. So now is a good time to really reinforce the risk reduction measures, our COVID prevention measures that we know work. So including universal indoor masking, making sure your workplaces have really good ventilation, communicating that employees, students, teachers stay home if they have any signs of illness, and our testing, especially after gathering and traveling before we all come back to work in the next couple weeks. And then for everyone else, like our sense of connection and well-being to gather with friends and family and loved ones is really important. And so make sure you're reducing your social interactions leading up to those important gatherings for you, so you can gather more safely with those that mean the most to you. So to make it safer right now, get boosted, get vaccinated if you haven't yet. Today's the day. If you need help finding a place to get your booster dose, visit vaccines.gov, or you can call our helpline, 502-912-8598. Now is also the time to refresh your mask. Make sure it's well-fitting and high quality. Recommending surgical or N95 mask. And if you want to wear that festive cloth mask, put it over a better mask while you're out in crowded indoor settings, in any indoor setting and crowded outdoor settings. And then do a rapid test the day of any gathering or traveling. Our COVID Test Now partners still have test kits available. So please look it up online, find one, pick up a test before you're gathering. JCPS has also opened back up its rapid testing sites across the community over winter break. Every high school has rapid testing available during the next 2 weeks. So check that out as well too if you're looking for a place to go. And then remember that gatherings are safer in well-ventilated spaces. Open windows for fresh air. Go outside if the weather is appropriate. And especially take extra precautions for high-risk people in your life. If you're gathering with grandparents or anyone over the age of 65 who may have more chronic conditions, like these protection measures with masks and testing and vaccination are even more important. And then I guess finally, I just want to say, make sure you take care of yourself. Remember that healthy habits like getting enough sleep and walking outside in the sunshine, eating healthy balanced meals really helps your body fight infection and stay safe. So don't forget all those things that are important for everything. It's really important right now as we move into the holidays.
All right, thank you, Doc. You just gave us a lot of information there, but if you would just, I heard you say some things that I haven't heard you say before, like if you're an employer, be prepared for your entire shift maybe to be off because of the contagiousness of the disease. So why are you communicating so strongly right now?
We just know Omicron is much more contagious than even Delta was. We thought Delta was bad, and we've seen this being effective. And as you saw, Dr. Hartledge mentioned, like seeing cases in even fully vaccinated. And while people do well, they're still out of work. And so workplaces, schools just need to be prepared that with multiple people out, being out when that does hit. And we're seeing that across the country and in Europe where it's happened sooner. And so just want to make sure people have those plans in place. It's a lot easier to plan for the worst and hopefully it doesn't happen than it is to be stuck in that situation.
No, I think we're demonstrating that we're living with this virus, but this is a new strain that's coming at us. So I think people really need to have their eyes wide open about how it could impact them. So thank you for being so direct on that.
Can I add something real quick? Dr. Moyer did a great job talking about COVID planning for employers or schools, but it's also important to have a COVID plan for yourself. So if you have symptoms, where are you going to go to get tested? If you have children or pets in the home, who is going to help take care of those if you become ill, that sort of thing. So it's good to think through those things before you get sick, and then hopefully you'll never need that plan. But it's good to have a COVID action plan for yourself, not just for your job.
Thank you, Dr. Hartledge. With that, Kathy, we'll throw it back to you for media questions.
Okay, thank you, Mayor. This first question is from Deb Yetter, and I believe you answered this, Dr. Hartledge, but would you like to confirm? Her question is, have any individuals in Louisville actually tested positive for the Omicron variant?
So yes, we have one confirmed case at this time, and I see a couple other questions. So she's 26 with no travel history. And so we believe that she acquired it locally, which suggests that the Omicron variant is circulating here already. And I think those of us who follow these things are certainly of the belief that it's been here for a couple of weeks. We are just now getting confirmatory labs for some of these patients. So her actual test positive date was a couple of weeks ago. And we just confirmed her Omicron variant yesterday.
Okay, thank you. I see that you addressed Tara Bassett's question. Deb Yetter is asking also, do we know if the patient with the Omicron variant had received a booster shot? And also, how many samples from Jefferson County are being sequenced to try to detect the variant?
So a patient with a confirmed Omicron variant case had received her 2-dose series. The first dose was in January, second in February. She had not yet had a booster shot. As far as how many samples are being sequenced for variant detection, at the moment, the only lab that is able to do that is at the state lab. But we are looking to have the updated definitions for our sequencing equipment and be able to increase that number quite a bit here in the coming days, so that we can do that testing locally without having to send it out, and hopefully we'll have less of a lag time between a positive test and a variant detection.
And Dr. Hartledge, can you talk about the difference between that and the wastewater detection?
Yeah, so the wastewater detection, they sample at multiple places across town, and it does. We have seen the Omicron variant in the wastewater. In general, the wastewater testing can tell us sort of a binary yes or no testing, right? So it can say either the Omicron is detected or it is not detected. And we can also see some trends when we see the amount that's captured going up. It does not necessarily correlate specifically. So we can't say that having X amount of Omicron in the wastewater equates to Y number of cases in people. So we definitely need the sampling in the patients as well. But the Omicron, it has been detected in the wastewater, I believe at 2 of the sampling sites. And I think we would expect to see more of that in the coming weeks as well.
Thank you.
Okay, thank you, Dr. Hartledge. And I just want to confirm, you mentioned that we will be able to do the testing for Omicron in our own public health lab, correct? Within the next 10 to 14 days, we hope.
Yes, we have, it's basically a software update for a machine we already have. And so we certainly hope to have that by the end of the calendar year.
Okay, this next question is from April Rickert. Can someone get one of the 3 US boosters if they've had AstraZeneca as their first shots overseas?
So there's a complicated flow chart involved in making these decisions, but the short answer is yes. If you've been vaccinated in South America or in Asia or anywhere else, in some cases, the patients are recommended to get the entire series again. In some cases, they're recommended just to start with the booster. We do have that chart at all of our LUVAX mobile missions. We deal with a large number of immigrant populations, so it impacts them pretty often. But in general, we look at these one at a time. But yes, they can get a booster if they have a documented shot from overseas.
Okay, thank you. I think you've answered Lawrence Smith's question, but I want to repeat it. Maybe you can confirm again what symptoms are the one confirmed Omicron patient displaying? Are her symptoms mild or more serious?
Yeah, she had relatively mild symptoms. She had a fever. I believe she had cough, but she never required oxygen or hospital admission or anything like that. So she did have some respiratory symptoms, but not severe.
Thank you. Deb Yetter is asking if anyone can speak to the effectiveness of this year's flu vaccine. Dr. Briones Pryor or Dr. Hartledge, can either of you speak to that?
So I can just tell you the cases that we've seen in the hospital. So at least for the cases that we've seen in the hospital, they've gone up since November. Most of those folks were not vaccinated. So if anything, we still need to get the flu vaccine. As far as the exact effectiveness, I can ask Dr. Hartledge to chime in on that.
Yeah, flu shots are an imperfect science. The powers that be make some guesses early on in the year. And one of the strains one of the strains in the flu vaccine appears to be very useful this year. The others, maybe not so much. The good news is you can get your flu shot and your COVID shot at the same time now. There's no need to delay between them. And the best plan is to put one in one shoulder and one in the other, and just keep your arms moving afterwards so that you don't get too sore.
Thank you. This question is from Jose Donis. Any plans to implement, or at what point, number of infections, mandates like capacity reduction in businesses? Mayor, would you like to answer that?
Sure, and thanks, Jose. No, it's been one of the things that we all share in common about this is frustration, right? Because we know what people need to do to stop the virus from spreading in our city and around the country. So what we'll be doing is paying very close attention to what this virus is doing here for us. We had before, as you mentioned there, some reduced capacity in businesses, trying to keep people away from each other, mask mandating, that type of thing. We all know by now what we need to do and what works in terms of separation, mask, and vaccines. So we're going to continue that. But if the city gets overrun by this variant, we're going to consider other measures. So we'll just play it by ear and see how all this comes together. Hopefully we won't have to do that. And the more everybody does the right thing from a public health standpoint, the better off we're going to be.
Thank you. And this last question is from Tara Bassett. When will home tests start arriving for individuals' use? And I am assuming, Tara, that you're referring to the president's plan to provide home tests. I don't know if Mayor, Dr. Moyer, Dr. Hartledge, any of you have any additional knowledge or want to comment?
But we know the president's going to give more details of that here today, this afternoon, but we have not been contacted yet that I'm aware of in my office, and I don't know if the public health team has either. Of course, we've got a lot of tests still from our prior allocation, I think, so maybe we can get some feedback from Dr. Hartledge on that.
I can jump in. I mean, yeah, Louisville was lucky in being one of the NIH CDC kind of pilot sites for the COVID Test Now site, and we, even though that ran in October and November, where we ship tests directly to people's homes, we still have tests available. And so, if you do not have any home tests at home, recommend you go pick some up. Here's a list of the sites that still have tests at their sites. So, take a look. We'll put that link in the chat. So please, you can. CVS, Walmart, a lot of stores are selling them, but then you can also pick them up for free at all these sites. So please do that if you're planning on gathering for the holidays.
Okay, and we did have one more question come in from Wave 3 News. At what point, with infection rates and spread, would another lockdown be possible? Mayor, would you like to comment on that?
There's just too many variables right now to comment on that with any specificity. We're at the early phase of Omicron here. Let's see what it does for the city and how we react to it. We've obviously got the holidays that we need to deal with as well. But, you know, and people, again, know what they need to do. So we really can't answer that question right now.
Okay, that was our last question.
Kathy, can I just add one more thing? So we know a lot of people are going to test positive over the next couple weeks, months, 2 months because of Omicron. So just want to remind everyone of everything we've been talking about for 2 years now. Please make sure you stay home for 10 days from the onset of symptoms or a positive test, except to get medical care. And as much as you can, separate yourself from other people in your home. If you can't isolate in your house or need supplies in order to do so safely, please call our helpline. We can help you with isolation housing and essential needs. And that number again is 912-8598. Also, please make sure you tell any close contacts that they have been exposed to COVID-19. That is anyone that you were around, especially within 6 feet, in the 2 days before you had any symptoms or tested positive. By letting your close contacts know that they may have been exposed, you are helping to protect everyone, because if we can have those people isolated and away from others, then they are not spreading it to other people when they possibly become sick. Close contacts that are not vaccinated need to stay home for 10 days since they last saw you, but vaccinated contacts can leave their house but need to monitor for symptoms and test as soon as you get any signs of COVID, whether that's fatigue or muscle aches, congestion, fever. And in those 10 to 14 days after you were close contact but are vaccinated, you need to be wearing a high quality mask and test at day 5 to 7 after exposure, even if you don't have symptoms. So just to repeat that, if you're not vaccinated, you have to stay home 10 days if you know somebody who got COVID. If you are, you're allowed to go out, but we want you to test at least 5 to 7 days after that exposure. And just one more reminder that our COVID helpline, 502-912-8598, is available 24 hours a day. You can call us anytime to help finding a test or a vaccination site for any guidance after you test positive or you've been exposed. There's many ways that we can help you. So please know that that is there 24 hours a day, even over the holidays. So call us with any questions. Thanks for letting me get that in.
All right. Well, thank you, Dr. Moyer, and thanks to the entire team here for keeping at it here for this past year. We wish we were past this, but we're not. So we know what to do better than ever. So again, I encourage everybody to follow the basic public health guidelines that we all know now very, very well. And that will be the best way that you all can send a message of Merry Christmas and Happy Holidays to the entire city. So Dr. Val, thank you very much for being with us. And Dr. Hartledge and Dr. Moyer, thanks to all the media for covering this vitally important issues. And I wish everybody a Merry Christmas. Take care. Thank you.